Hi, Senator Mark Warner, wanting to give you another update on the coronavirus. I know this is a strange time for all of us. I hope everybody is, again, continuing to listen to healthcare officials about social distancing, washing your hands, staying safe first and foremost. Yesterday, some good news. The Senate passed legislation that actually I wish we would have passed a week ago that was geared at some of the economic consequences. It will increase unemployment benefits. It will provide paid sick leave. It will ensure as well that there's some basic additional support for free testing. So all steps in the right direction. But 6 weeks, 8 weeks into this crisis, our country is still behind. It still is remarkable to me that we don't have enough testing equipment out there, that the United States has tested roughly 15, 16,000 people. South Korea has tested over 260,000 people. So I'm still hearing from hospitals and docs around Virginia, and for that matter around the country, how are we going to get them more testing equipment? We're starting to use not only our state testing lab, but we are also using some of the private labs, Quest and LabCorp here in Virginia, and one of their facilities is opening up in Northern Virginia that allow the tests that taken to actually be examined up here and processed up here, again, cutting down on the timeline. And I'm also reaching out to the FDA to make sure that both UVA and VCU, they can create their own test. They need to just get federal approval to move forward with that. So some more movement on the legislative front, beginning to see progress on testing. We're still a little bit behind, but hopefully we'll see more progress there. One other thing that's important from those who are small businesses around the Commonwealth, we did get an emergency declaration so that small businesses can apply to the SBA and apply for emergency loans under the Classic 7A program. All this is good, but I think there's going to still need to be a lot more. I think we're looking at an economic downturn unlike anything we've seen in recent times, perhaps even worse than 2008. So I'm working with a number of senators to put together a much larger facility that would help back small and medium-sized businesses, everything from the restaurant to that 800-person custom ink company in Fairfax, Virginia. This would provide very low interest loans and then give incentives to actually have those loans forgiven if, if we can make sure that businesses will bring back people as quickly as possible once the health crisis has passed. We're also looking in this next slug of support to do something that would, again, greatly expand unemployment insurance called disaster unemployment insurance that would allow you to get unemployment and not have to sever your relationship with your employer. I think really important. We don't want to break that relationship where people actually have to get fired. We want to maintain that working relationship even if you're not working, so you can still get whatever benefits. And we're also trying to make sure that this new initiative includes all those gig workers, that Uber driver, the Lyft driver, all the 1099s, which are independent contractors, all the folks who may be, working part-time on IT consulting, maybe, playing in a band on a weekend, the whole hodgepodge of different kind of income streams that come together. My goal here is to make sure that nobody should lose their job, their paycheck, or not have the flexibility to take care of their kids as we go through this challenge. So I hope to continue to provide these updates. The government's made 2 efforts so far. We're now working on what's called, as I said, the 3rd larger package. I continue to work with private companies as well in terms of relief. As I mentioned in the last update, Uber and Lyft and some of these companies are starting to provide some level of sick leave if you're in mandatory quarantine. I've also got the internet providers to agree that they will lift all of the monthly caps on data. So if you have to work at home or work or study at home, you're not going to run into any data caps. And for those Virginians and Americans that don't have broadband at their home, trying to make sure that the companies can provide free Wi-Fi hotspots so that people can, even if they have to go to a location, can again still not fall behind on their work or on their studies. Going to be a challenging time. I hope folks in the White House will let the healthcare professionals do a little bit more of the talking. I feel concerned at times when we hear the president make statements that don't have any kind of medical background in terms of how quick we'll see a vaccine or some kind of solution. I think we got to realize our healthcare professionals and around the world are working on this, but we have to do this in a safe and efficient manner. And at least for the foreseeable next few weeks or even few months, I don't think we're looking at anything in a vaccination that will be available for the general market. So stay tuned, hang in there. We will get through this as Virginians and Americans, and I'll continue to try to update you on a regular basis. Thanks so much.